I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks magazine, and I'm here today with Teri Fontenot, President and CEO of Women's Hospital in Baton Rouge, Louisiana, and Chair-elect Designate of the American Hospital Association. Teri, thanks for joining us today.
Thank you.
You're going to be moving into a leadership position on the AHA board at about the time when most of the hospital-specific components of the Affordable Care Act are going to be kicking in, or at least moving into the regulatory phase. So tell me what you think hospital executives, your peers, need to be thinking about now on some of these specific issues. And maybe we can start with value-based purchasing and bundled payments. What do you need to be thinking about now to be prepared for 2013, 2014?
I think it's going to be extremely important whether you employ your medical staff or you have the more traditional relationship with them, since the payments are going to be bundled and you're going to be sharing the reimbursement with other providers to get them in the room as soon as possible and everyone become educated about the portion of care that the others are going to provide. Hospitals shouldn't assume that, and particularly hospital executives, that, well, we're going to get the biggest share of this probably, so we'll kind of drive this thing. I think that's absolutely the wrong way to go about it. There's a lot for us to learn about the way physicians provide care in their offices, about the way that nursing homes run and home health agencies, and all the other input points for when payments get bundled, because it won't just be physicians and hospitals, it'll be a lot of other providers as well. So everyone needs to be at the table and everyone needs to have some skin in the game, but we also need to have really honed our listening skills, I think, to make sure that we understand what the implications and what the opportunities are for everyone to contribute so that the patient can get the best possible outcome.
Okay. Again, thinking about what the executive needs to think about now, what about accountable care organizations? And granted, we don't really know yet what CMS is going to set forth in any demonstrations, but how do you start gearing up for that framework?
Well, I think it's very similar to what we were talking about with value-based purchasing. It's going to be a number of different parties that are involved and have to work together in order to provide a product, a new healthcare product that's going to help patients better manage their health and keep them healthier rather than manage them when they get sick. So I see value-based purchasing very much integrated and linked to accountable care organizations. I think the lessons learned from one can be utilized to develop the next.
So hospitals did not universally endorse the Affordable Care Act. There were some that liked it, some that didn't. You've talked a little bit in the past about consensus building in the field. As you move into a leadership role within the AHA board, what are you going to have to do to unify the field as health reform moves forward?
Well, hopefully the things that the American Hospital Association prognosticated would happen will be what happens. And I know that the American Hospital Association the board and the leadership did a tremendous amount of work and a lot of consensus building. When I was on the board from 2005 to 2007, we started this initiative. So I'm familiar with the way that the consensus building occurred and was honored to participate in a lot of that. We had other trade associations, other physician groups, insurers, a lot of people at consumer groups, a lot of people at the table to try to figure out what would be the best way to go about this. And I know that there are a lot of components to the healthcare reform legislation that haven't been finalized. There are going to be some things that are going to be changed. I'm certain of that. So if we can listen to our membership, and when they advise us of areas that they have grave concerns about or once implemented it's not working well, then because of the relationship that the American Hospital Association has with our federal leadership, I believe we're in a really good position to be able to communicate the consequences, the unintended consequences, and hopefully be able to move those unintended consequences back into the realm of we're trying to move forward to have a healthier population. It's probably a mistake to think that everyone will agree that's a member of the American Hospital Association on every aspect of healthcare reform, and I don't myself. Personally, I think that there's not enough responsibility for the patient in this healthcare reform legislation, but I'm also optimistic that once we move into the next phases of this, that patients will have more responsibility for their health care. Right now, as I see healthcare reform, the main responsibility or penalty that patients have is whether or not they enroll in an insurance program. But I'm talking more about not smoking and wearing a seatbelt and eating healthy and exercising and things like that that will go a long way for personal patient accountability that will certainly contribute positively to healthcare costs in this country. So hospitals and physicians can't do it all. What I plan to do personally in this position as chair-elect of the American Hospital Association is be very available and hopefully very open-minded and really work on my listening skills and take good notes so that we can receive that information and do what we need to with it so that ultimately everyone's best served.
Okay. You also referenced the idea of doing more with less or better with less, I guess. Obviously there are significant cuts that the AHA agreed to in supporting the legislation, and then on top of that we're going to see those year-to-year changes in the market basket that CMS always puts forward. So what is the message to the membership that's uneasy about we've got big cuts in health reform and then we continue to have the year-over-year changes that CMS is going to propose in the inpatient prospective payment system?
The expectation is that the $155 billion in Medicare cuts that the American Hospital Association agreed to over a 10-year period will be returned in the way of patients who had been uncompensated previously will have some level of insurance, and that by using value-based purchasing and having the ability to work more collaboratively and share risk with physicians and other caregivers, that the cost of providing the care will go down. We just have to be patient. It's going to take a few years to get all these things in place, and as we all know, there are many parts of healthcare reform that haven't even been determined yet. So, and I think that's a good thing. I think it's wise that we didn't have this 2,000-plus page bill passed with everything tied down. It gives us an opportunity to tweak it as we go and figure out what needs to be modified or refined as we go forward, because this assumption's not holding and this assumption is.
As hospitals look to the future of health reform, what role do you think the AHA's Hospitals in Pursuit of Excellence program is going to play, and how do you envision that unfolding as you move into chair-elect and then chair of the board?
The work that the American Hospital Association has already done, the white papers, the tracking of the healthcare reform legislation quarter by quarter, this is what's going to happen, lining it out by consumer and insurer and provider, that is an excellent document, and I would suggest to everyone that they look at that, share it with their board, share it with their community, share it with their medical staff and employees. Now it's education, communication, and engaging the membership and making sure that the membership is comfortable with sharing that information. So the tools and the resources that the AHA team have already provided, and I know will continue to provide, are going to be extremely critical if we're going to be able to keep people moving forward and make sure this is a dynamic process without, and trying to keep some of the hysteria down.
Trustees are integral to implementing health reform. What do you think is the key role they're going to play with the executive team in implementing some of the changes?
Well, on our board, it's a community board, so we have a lot of physicians, but the majority are community leaders, and they come from banking, construction, entrepreneurs, insurance. So I think one of the most valuable things that they can bring to the table are their own experiences. In addition, if hospitals have to make some unpopular decisions that affect patients or the community or even the medical staff, those trustees have an opportunity and an obligation to help communicate why those decisions were made and why ultimately it's going to be in the best interest of the community and of that hospital so that they can be there to continue to serve patients.
So you see them increasing their advocacy role, for lack of a better word.
Absolutely. And advocacy also at the state and federal level with the elected and appointed officials in various government agencies. Our board has always been fairly active in that regard, and many trustees are nervous about doing that, but if they just talk from their heart and talk about what they know, that's what I've found most elected and appointed officials really want to hear. And trustees serve as volunteers. It's because they care.
Thanks for coming in to talk to me today, Teri.
Thank you. It's my pleasure.
For more of my interview with Teri Fontenot, please look to the November issue of Hospitals and Health Networks magazine.